Diabetes is a chronic metabolic disorder that occurs when the body either doesn't produce enough insulin or can't effectively use the insulin it produces. This leads to high blood sugar levels, which can cause various health problems over time. While diabetes is usually associated with symptoms like increased thirst, frequent urination, and blurred vision, there are also several skin signs that may indicate diabetes. These skin changes can occur because of high blood sugar levels or as a side effect of diabetes complications. So here are 9 crucial skin signs of diabetes you should be aware of. Before we get started, be sure to hit that like button for more health and wellness videos. Also, this video is for educational purposes only, so do speak to a doctor if you have any medical concerns. Number 1. Darkening of the skin. One of the first signs of diabetes is darkening of the skin, particularly in areas where the skin folds such as the armpits, neck, and groin. This darkening is caused by a condition called acanthosis nigricans, which is characterized by the buildup of a dark, velvety skin due to an increase in insulin levels. When someone has diabetes, their body may produce more insulin than usual, which can lead to the growth of more skin cells in certain areas. As a result, the affected skin becomes thicker and darker. It's important to note that while darkening of the skin can be a sign of diabetes, it can also be caused by other factors such as hormonal changes, obesity, and certain medications. However, if you notice any unusual skin changes, it's always best to consult a healthcare professional for a proper diagnosis. No. 2. Dry, itchy skin. Another common skin problem associated with diabetes is dry, itchy skin. This can happen for several reasons. First, high blood sugar levels can cause the body to pull water from the skin, leading to dehydration and dryness. Additionally, people with diabetes often have higher levels of triglycerides in their blood, which can affect the skin's ability to produce oils and maintain its moisture barrier. Lastly, nerve damage caused by diabetes, known as peripheral neuropathy, can also contribute to dry, itchy skin by affecting the body's temperature regulation and sweat production. To manage this issue, it's important to moisturize the skin regularly using a thick cream or ointment, especially after bathing. You should also try to keep your skin cool and dry by wearing loose, comfortable clothing and avoiding hot showers or baths. If the itching persists or worsens, consult a healthcare professional for further evaluation and treatment. Number 3. Cuts and scrapes that are slow to heal. Slow healing of cuts and scrapes is another possible sign of diabetes. High blood sugar levels can impair the body's natural healing process, making it more difficult for wounds to close and regenerate tissue. People with diabetes may also be more susceptible to bacterial and other infections, which can further complicate wound healing. Additionally, poor circulation caused by vascular diabetes complications can affect the delivery of nutrients and oxygen to the wound site, slowing down the healing process. To promote wound healing, it's essential to keep blood sugar levels within the target range, eat a balanced diet rich in vitamins and minerals, and avoid smoking. If a wound appears infected or shows signs of delayed healing, seek medical attention promptly to prevent further complications. Number 4. Tingling, burning, or needle-like sensations in the feet or hands. If you experience a tingling, burning, or needle-like sensation in your feet or hands, you might be dealing with diabetic neuropathy, a condition that affects the nerves typically caused by high blood sugar levels over time. This can damage the nerves and lead to various symptoms, including numbness, weakness, and pain. The early stages of diabetic neuropathy may not be noticeable, but as the condition progresses, you might start to feel these uncomfortable sensations in your extremities. It's important to address this issue promptly, as diabetic neuropathy can worsen over time and lead to serious complications such as foot ulcers or infections. To help manage this condition, you can engage in regular physical activity, maintain a healthy diet, and consult a healthcare provider about medications or therapies that may help alleviate your symptoms. Number 5. Changes in hair growth or excessive hair growth. Diabetes can also cause changes in hair growth or excessive hair growth. People with diabetes may experience hair loss or thinning in certain areas due to high blood sugar levels damaging the hair follicles. Additionally, poor circulation caused by vascular diabetes complications can affect the delivery of nutrients to the hair roots, leading to weaker, thinner hair. On the other hand, some individuals with diabetes may experience excessive hair growth, particularly in areas such as the upper lip, chest, and back. This is due to an increase in insulin levels stimulating hair growth. However, it's important to note that these hair changes can also be caused by factors other than diabetes, such as stress, hormonal changes, and nutritional deficiencies. If you notice any significant changes in your hair growth patterns, consult a dermatologist or healthcare professional to determine the underlying cause and receive appropriate treatment. Number 6. Skin tags. Skin tags are small, benign growths that can appear on the skin, and they can also be a sign of diabetes. While skin tags are not directly caused by high blood sugar levels, their presence is associated with insulin resistance, a hallmark of type 2 diabetes. Insulin resistance occurs when the body's cells become less responsive to insulin, leading to higher blood sugar levels. This can create an environment where skin cells grow and multiply rapidly, resulting in the formation of skin tags. Additionally, individuals with diabetes may have weakened immune systems, which can contribute to the development and growth of skin tags. While skin tags are generally harmless, it's essential to monitor them for any changes or growth, as they can sometimes become irritated or infected. If you notice any suspicious skin tags, consult a healthcare provider for professional advice and treatment options. Number 7. Blister-like lesions. Blister-like skin lesions can be a sign of diabetic dermopathy, a common skin condition that affects people with diabetes. These lesions typically appear as light brown, scaly patches with a defined border, resembling blisters that have ruptured. They often occur on the legs, buttocks, or upper chest and are painless, but may cause discomfort or itching. Diabetic dermopathy is thought to be caused by a combination of high blood sugar levels and vascular diabetes complications, leading to insufficient blood flow and oxygen supply to the skin. While these lesions are usually harmless and resolve on their own, they can be persistent and may require treatment to alleviate symptoms. Consult a healthcare provider for proper diagnosis and management of diabetic dermopathy. Number 8. Red scaly patches. Red, scaly patches on the skin can be a sign of eczema, a common skin condition that can affect people with diabetes. Eczema is characterized by inflammation of the skin, leading to itchy, dry, and scaly patches, which can be worsened by high blood sugar levels. People with diabetes may also have a higher risk of developing eczema due to their weakened immune systems and impaired blood flow. Additionally, exposure to environmental factors such as cold weather or harsh detergents can trigger or exacerbate eczema symptoms in individuals with diabetes. To manage eczema, it's important to moisturize the skin regularly, avoid scratching the affected areas, and wear comfortable, breathable clothing. If the condition persists, consult a dermatologist for appropriate treatment options. And finally, number 9. Changes in skin color or temperature. Changes in skin color or temperature can indicate circulatory issues related to diabetes. Poor blood circulation caused by vascular diabetes complications can result in pale or bluish skin discoloration, particularly in the feet and hands. This occurs when there is insufficient blood flow to deliver oxygen and nutrients to the skin cells. Additionally, high blood sugar levels can damage the small blood vessels in the skin, leading to the formation of new blood vessels that are fragile and prone to bleeding. In severe cases, this can result in ulcers or wounds that are slow to heal. To improve circulation, engage in regular physical activity, maintain a healthy diet, and manage blood sugar levels effectively. If you notice any changes in skin color or temperature, consult a healthcare provider promptly to address any underlying circulatory issues. If you enjoyed this video, please like and share for more health and wellness videos. And remember, knowledge is power. Stay informed, stay healthy.